Good morning, and thank you for joining us today. I'd like to acknowledge that the land that we are gathered on today is the unceded territory of the Mi'kmaq people. My name is Michelle Beaton. I'm the MLA for Mermaid Stratford, and I'm the health critic for the official opposition. My colleagues and I have been hearing from families straight across the province who have raised concern about the state of long-term care. Island seniors living in long-term care have been significantly impacted by COVID, and this is why I've raised concerns on several occasions to give the attention that it deserves. But it's important to acknowledge that this treatment happened long before COVID. Recently, Minister Hudson announced that there would be an external panel to look at the impacts the COVID response had on long-term care. But this does not go far enough, and this is why myself and my colleagues have called for a public inquiry into long-term care in Prince Edward Island. The Premier and Minister Hudson seem determined to ignore this call. We feel it is necessary for the Premier and his Minister to hear the experience of the families and loved ones of those living in long-term care. So today, I gather with the Honourable Peter Bevan-Baker, and we have two families that have joined us today. And I'd like to thank Jean Cutcliffe and Patricia Thorburn-Manetta, who have joined us to speak on behalf of their loved ones. I'd like to begin by introducing Dr. Peter Bevan-Baker.
Thank you very much, Michelle. Thank you all for coming here today. Bonjour et merci d'être ici aujourd'hui. Kwe, Jalasi. I especially want to thank Jean and Patricia for joining us today and to share their family stories. It's a brave and courageous thing to do, and I very much appreciate it, and the other family members who are gathered with us today. And I want to thank personally Michelle Beaton, my colleague, for her tireless work and her passion to always be improving the healthcare system here on Prince Edward Island in all of its many aspects. Across the country, of course, COVID has exposed some serious and disturbing realities that our seniors face in long-term care homes. And as I suspect many islanders did at the very beginning of COVID, going back a couple of years, we saw the issues that were out of control in long-term care homes, and we thought that that was a problem elsewhere, that this was an issue in the larger provinces. This was a Quebec problem, or this was an Ontario problem. And it was really hard to think that our island seniors may be living in the same sorts of conditions that we saw daily on the national news and that were so upsetting. But unfortunately, that's exactly what was going on here and what continues to go on here. Here on PEI, we've heard so many stories of residents who are not getting out of bed for days, who are not bathed for weeks, who eat alone in their rooms day after day after day. And of course, we were told by government and by private long-term care operators that this was indeed a consequence of COVID, which of course did have a profound impact on all parts of the healthcare system, including long-term care, but that it would be quickly reversed once we were through the acute phase of COVID. And again, unfortunately, that's not the case. These disturbing conditions have been a reality in our long-term care facilities for a very long time, and long before COVID was a part of our lives. You know, for a very long time, we have not met the duty of care that we owe our island seniors. A few weeks ago, the Premier announced a new external panel to study the impacts of COVID-19 on long-term care homes here, rather than a public inquiry. And we have some concerns about that. There are some serious limits on what this panel will be able to do compared to what it could do if we were to establish a commission under the Private Inquiries Act, in other words, a public inquiry. For example, the panel, as it has been constructed, has no powers to compel private operators to provide necessary documents. They are also not compelled to provide testimony. And let's not forget that fully half of our long-term care facilities here on Prince Edward Island are privately owned. So that really severely limits the ability of the panel to obtain all of the information that they will need for the full and thorough study of long-term care that we think is absolutely necessary. The other issue with the panel as it has been constructed is that they will report back to the Premier and his cabinet, and then they will get to decide what to release and what not to release. So unfortunately, the King government has made a very conscious decision to restrict this panel and its ability to do what really needs to be done to uncover all of the challenges within our long-term care system. And of course, all of the things that are also going very well in our long-term care system. We're not here to say that everything is wrong. Not at all. There are many good things. But unless we have access to all of the information, and unless government is going to provide islanders publicly with all of that information, we're not going to have all of the things that we need to know. And if we don't know all of the challenges that we have, we will not be able to understand what we need to do to fix that. Since calling for a public inquiry, our office has heard from a large number of loved ones across this province, loved ones of long-term care residents. And we've also heard, and this would predate our call for a public inquiry, we've heard from many frontline healthcare workers in the homes. And every story is unique and different, but they all have some commonalities. And those commonalities are that they are both heartbreaking and that they are alarming. And they clearly show that the effort and the time and the money required for a full public inquiry is absolutely necessary and worthwhile. And today, we have with us two representatives from two families who are brave enough and selfless enough to share their difficult and their painful experiences with us, and I'm extraordinarily grateful to you. And together, we are asking other islanders who may have experienced similar issues in long-term care facilities, or if you are a frontline worker in a long-term care facility, to come forward and to share with us your stories. And with their permission, of course, we will continue to share these experiences with islanders to start a conversation about what it's like for islanders, what it's really like for islanders who are living and working in long-term care here. We want to inform all islanders of the realities that some of our island seniors are facing in long-term care. And again, I want to reiterate that there are many good things happening in our long-term care facilities, but there are problems also, some serious problems. And our concerns today are related to government failure. This is not a critique of the frontline workers who are working so hard, so diligently, so carefully, so lovingly in our homes, in a system which does not allow them to provide the level of care that they want and need to provide for island seniors. Islanders absolutely deserve to know the truth about the state of long-term care in Prince Edward Island, and we owe it to the family members that have lost loved ones prematurely or have experienced neglectful care. And we also owe it to those frontline workers who are working so hard and who have been raising concerns with us as the official opposition for years. So with that, I would like to pass the lectern over to Jean Cutcliffe, who is going to share her mum's experience in long-term care. Thank you for being here, Jean. Merci. Walalio.
So my name is Jean Cutcliffe, and I had a close relative. It was actually not my mum. It was my mum's first cousin, as a matter of fact. But that's okay. She was like a mum. So she was in a long-term care home here on the island. She was a wonderful, happy lady who was always dressed to the nines, from her hair to her shoes. Clothes she wore, jewelry she wore. She never wanted to bother anyone. She never spoke badly of anyone. She was just the kindest soul. And she was actually very fortunate. She spent several good months at Geneva Villa, and she enjoyed the activities there, good care, everything. But unfortunately, she fell. She had a hip surgery, then she had a leg amputation. So she became wheelchair bound and she needed more care. So she entered a long-term care home in November 2019. So that was pre-COVID. And from the first night in that facility, her dignity was taken from her. Unfortunately, there are too many issues to speak about in a short amount of time, but she was cautiously excited at the time of entry to have her meals and her care and, maybe some social activities, etc. When I went in to see her the next morning, I asked her, how was your first night? She began crying. Well, I'd never seen her cry until that day. So she had buzzed for assistance to go to the washroom the night before. And after waiting for quite some time, a staff member finally came and told her that they don't get residents up at night to go to the bathroom. She said, that's why you wear a diaper. Wow. So she said, that's why you wear a diaper, and the morning staff will clean you up. Now just imagine if someone said that to you. How would you feel? It's bad enough that you have to ask for help to go to the washroom, but then to be denied assistance, basically told to mess yourself. And sleep in it all night. So I've spoken to other families, some are here today, who have unfortunately had the same experience. So my loved one suffered UTI after UTI while in the home. When I was speaking to her on the phone, she was talking about going to work, which obviously she wasn't going to work, and about her deceased husband making her a lobster lunch. So basically talking crazy. So I knew there was something wrong, so I called the nurse's station. And I said, I think maybe she has a UTI. Anyway, they just said, no, she's fine. So they didn't even go look. So basically I had to demand a test, and it was done. And yeah, it came back positive. And she was given antibiotics. So this situation happened so many times, numerous times. It was always my insistence and calls to the home that led to these tests being done. So here I was calling from another province, which was Ontario, to tell staff that she wasn't right. She was in the home to receive care, but she didn't get the care. The final straw came on the night of August 2nd, 2020, which was during COVID. So that was less than 9 months after she entered this facility. She was taken to the hospital by ambulance. So the way that happened was I was speaking to her on the phone. And about 9:30 at night, she sounded very, very weak. She said everything was dark. She couldn't see. She couldn't open her eyes. I was scared she was having a stroke, so I called the nurse's station, expressed my concerns. And the nurse that was on duty said she's fine. She didn't even go look at her. I insisted she go to her room to check on her. So she asked my relative, how are you? And she said she was fine. She said, oh, she's just sleeping. And I said, well, she's not fine. She can't open her eyes. And I said, she has to go to the hospital right now. So I was told, the staff member told me she wasn't able to call an ambulance. She wasn't allowed to do that. So me being me, I said, well, two choices, you either call or I call. So she called, and she was taken in. So she went to the QEH. She was in a very bad state when she arrived there. She looked like a corpse in the picture that Lisa sent to me. The nurse on duty told Lisa, my sister-in-law, that she couldn't believe the state of her. She was so dehydrated. She was so dehydrated, her eyelids were stuck to her eyeballs. Her catheter was beyond disgusting. It looked like it hadn't been cleaned or changed in a very long time. She was full of infection from a UTI that, again, wasn't treated. And she had cellulitis in her leg, and the only leg she had left. So apparently she was unable to unbend her leg too. We weren't aware of that until the nurse told us. So basically my question is, how can a nursing home that is supposed to be providing care allow this to happen? You know, it didn't happen overnight. Basically, in my opinion, it was a case of long-term neglect. Now, our seniors, they deserve better than this. Change does need to happen, and the government needs to start making changes to the system right away. There needs to be, in my opinion, uniform standards of care and training in place for both government-run and privately run, because we all know there's a huge difference in the training in these facilities. And I also think surprise inspections need to be done. Right now, they're booked ahead of time. They know when they're coming. Well, yeah, everything's going to be perfect. And these people that go in to inspect, like, who talks to the staff or the residents or the families of all these loved ones? Nobody. Complaints are sent to the homes and to public health. I know I've sent complaint in. I know many other families that have sent complaints in. But what becomes of them? You never hear. So there needs to be stronger penalties in place for these homes who violate the standard of care. And I do hope that our provincial and federal governments both find it basically in their hearts and pocketbooks to listen to these families and residents and staff and promote change. I think a public inquiry is extremely important, and so we can access all these important records as soon as possible. And I thank you.
Thank you, Jean, for sharing your story. I appreciate the reason why you've done this, and I understand just how challenging it is to open yourself up and to share that care. And I know that you're doing this for the reasons to help everybody else. And I'm truly sorry for what happened to Marion. Next, I would like to call on Patricia Thorburn Manetta, who would like to share the story of her mother while she was living in long-term care.
Good morning. Thank you, Michelle, for inviting us to share our family's experience. Our mother was 88 years old, valued her independence, loved to socialize, read books, and play games on her iPad. She kept in touch with family and friends on her laptop and texted on her iPhone. She was sharp, very sharp, witty, and loved to laugh. Prior to long-term care, Mom lived in a wheelchair-accessible studio apartment at Geneva Villa here in Charlottetown. She loved it there and being in a wheelchair never limited her ability to have a fulfilling life. And I just learned that Jean's relative also had a wonderful experience at Geneva Villa. So, on July 27th of 2021, Mom fell and broke her elbow. When she was admitted to the hospital, the doctor remarked how healthy she was for 88. Unfortunately, Mom was unable to return to Geneva Villa because the elbow injury meant she could no longer transfer herself from her wheelchair to her bed, etc. So when she was discharged from the hospital in the beginning of October 2021 and admitted to long-term care, she was in very good health and looking forward to becoming social again. My sisters did their best sourcing a long-term care placement for her, and after visiting several facilities, the family chose a facility here in Charlottetown because we were assured they could meet my mother's needs. They had wheelchair accessible rooms, a fully functioning dining room, social activities that provided an opportunity to interact with other residents. But this proved not to be the case. 36 days, that is how long it took our very vital mother to be stripped of her dignity, her independence, and finally her life. 36 days. The current system is not set up to accommodate seniors who are cognitively alert but mobility impaired. In our case, Mom was able to tell us what was happening. For those families whose loved ones are cognitively impaired, I can only imagine how hard it must be. This is only worsened if you have limited financial means. Mom's room did not meet her basic needs, as this was not even the room that was viewed prior to choosing the facility. With no wheelchair accessible bathroom, Mom was forced to use a bedpan and wear a diaper. In fact, her first night, she was told to soil herself and they would clean her up when they had time. And my mother told family this the next day with tears in her eyes. She was chastised for ringing the bell for assistance, and during the visit, my sister, Jackie, witnessed her waiting more than 20 minutes for help to arrive. My very social mother was denied access to the dining room and had limited access to social events. Mom felt more isolated at this long-term care facility than the 3 months she spent at the QEH waiting for a long-term care room. Within the first few days, she was asked not to use her mobility chair, her last vestige of independence, because the hallways were too narrow to accommodate it. It was placed outside her room, out of reach, confining Mom to her bed. There were many, many more red flags during the month in the long-term care facility, and just too many to include today. We want to be clear. There are some care workers that are dedicated, but the system is so broken, everyone, including residents and some family members, are afraid to speak out, leaving many, many seniors at risk. Breaking your arm at 88 should not be a death sentence. We hope to spare other families this absolutely heartbreaking experience. I thank you very much.
Thank you, Jean. Thank you, Patricia. We are here also to take any questions from media that they may have for either Michelle and myself, or for Jean and Patricia.